first stage of labour can be divided into two parts, the early or latent phase of labour and established or active labour. And in this video we're going to think about early labour. So this is the very beginning, from those first signs of labour starting up to you being about 3 or 4 centimetres dilated. Now you won't know how dilated you are, but there are various things that you can look for in the way that your body is behaving to give you an idea of when it's time to think about going into hospital. If you go into hospital too soon in early labour, you will almost certainly be sent home again, because we know that for the vast majority of women, the best place for them to spend the beginning of their labour is at home, because they tend to be far more comfortable there. There are things you can do at home that you can't do in a hospital or birth centre setting. You've got freedoms at home. You can go and have a bath or a shower when you feel like it. You can eat and drink what you want to. You can watch TV or a movie. You could take your dog for a walk if it's a lovely day. You could bake a cake to celebrate your baby's birthday. All sorts of things that can act as distractions in early labour and help you to pass the time in a comfortable way. You can also rest as often as you want to, and there's nowhere nicer to rest than your own bed or your own house. So using that time to be at home tends to be a very good use of that time. So what we're looking for with the contractions is that they come from being quite erratic quite often to being far more in a good pattern. So to begin with, you might find that your contractions are all over the place. They are different lengths, they are coming at different times, they are different strengths, and over a period of time, usually many hours, but sometimes less, sometimes more, you want to see that those contractions are settling into a rhythm, that they are coming fairly regularly. You want to see that they're lasting about a minute long, they're coming about every 3 minutes from the end of one to the start of the next one, and that they become strong enough that you find it difficult to talk through them. If you've got at least 2 or all 3 of those criteria ticked, then it might be time to consider going to wherever you're going to have the baby. But whilst it's still a bit erratic, then you are best off staying at home, because you don't want to waste a journey and to be told that you need to go home again. Being sent home is not much fun. So look for those contractions coming longer, stronger and closer together, and that would suggest you're going into the active phase of labour.